Urgent care clinics are everywhere now, and that is not an accident. Because for the right operator, an urgent care can be a very attractive healthcare business, sitting right in the gap between primary care and the emergency room. Most people think urgent care is just about convenience, shorter waits, walk-ins, nights, and weekends. But from a business perspective, urgent care works because it solves a very expensive problem in healthcare. Urgent care is attractive because it gives patients a faster, cheaper option than the emergency room for many non-life-threatening issues. The Urgent Care Association says the average urgent care visit costs about $171, compared with an average emergency visit cost of $1,646. If a patient can be treated safely in urgent care instead of the ER, payers save money, patients save money, and the clinic captures the visit. That is a big reason the market has grown. Grandview Research estimates the U.S. urgent care centers market at $36.4 billion in 2025. At the most basic level, urgent care clinics make money one visit at a time. Patients come in for things like rashes, flu symptoms, minor injuries, physicals, and basic lab work. Revenue usually comes from a mix of office visits, diagnostics like lab work or imaging, and occupational medicine contracts. Here is a simple example from the Urgent Care Association site. If a clinic sees 60 patients per day and averages $171 per visit, that's $10,260 per day. If that clinic operates 30 days in a month, that's $307,800 per month. Now, this is gross revenue before expenses, but it shows why volume matters. Not all urgent cares are created equal. The ones with on-site imaging and a lab can see a wider array of complaints. The ones with school and occupational medicine contracts have steady revenue. That matters because higher value services can increase revenue without needing dramatically more patients. By solidifying these contracts for local companies, it provides a steady stream of income for the urgent care. So the business is not just about being busy. It is about visit mix, reimbursement mix, and whether the clinic can deliver more services efficiently. Urgent care is not easy money. The big expenses are usually staffing, rent, medical supplies, and equipment. So even if revenue looks strong, margins can get squeezed fast if labor costs are too high or payer contracts aren't favorable. This is why many are staffed with mid-levels, or advanced practice providers, like nurse practitioners, to provide this high-quality care at a lower cost than physicians. $140,000 is a big difference from $350,000. The real business advantage is that urgent care sits in a useful middle zone, and many insurance companies are insisting on utilization of urgent cares since they are cheaper than the ER. They are often much faster than waiting for a primary care visit. There is also research showing urgent care centers can reduce non-emergent emergency department usage. One peer-reviewed study found that having an open urgent care center in a zip code reduced total ED visits by residents in that zip code by 17.2%. That helps explain why the model keeps expanding. Everyone benefits from it. That is how urgent care clinics actually make money, not just by being convenient, but by delivering lower-cost care, capturing repeat visit demand, and operating in one of the most valuable gaps in healthcare.